and welcome to Insure Your Health. My name is Erin Ackenheil, and I work at Black Point Insurance, where we help Medicare beneficiaries nationwide learn about the A, B, C's, and D's of Medicare, and we help agents and brokers in the same space learn to launch, grow, and retain their businesses. Through that, we have this episode of our show called Insure Your Health, where we feature three different dynamic groups. So one is we do industry experts who talk about all things Medicare, so compliance, marketing, sales, helping you have the tools you need to go to market if you're an agent or broker, or if you're a Medicare beneficiary, understanding your plan and how it works. The second piece is we feature carriers, where we bring on spotlights where they talk about their unique value proposition and the benefits they have to offer to make sure you have good education on the plans that are available that might meet your needs. And then finally, I am super excited for our third edition, which is what we call our Provider Spotlight Edition. And this is where we feature physicians in our community that are doing amazing work, dynamic individuals that are innovative in their fields, bringing best practices, have the patient at the center of everything they do on all the hot topics that face Medicare beneficiaries and really face all of us today. And no more important work is there than I think for females in particular, that we have Dr. Mona Orady on with us today, and she is amazing. I mean, I am just blown away with this resume. She was known as the Sherlock Holmes of gynecology, right? In terms of, and she can tell us about that background, but in her career, because she's so good at being thorough with patients and diagnosing and figuring out what's going on with them. And then she features all kinds of non-invasive procedures through her practice and through her work that really present good outcomes, but are good for the overall body. And I know, in addition to just recently launching her own business, which she's going to tell us all about, so it's she'll tell us all about that. In addition to that, she also is the head of robotics or robosurgery at St. Francis Hospital. And so we're going to learn all about what that is and all the amazing work that Dr. Orady and her team are doing. She's located in San Francisco. Her credentials, her CV is a mile long, and I am so happy to present to you Dr. Mona Orady. So welcome to the show, Dr. Orady. Thank you for joining us.
Well, thank you, Erin, for having me. I'm really happy to be here and to kind of share kind of what I do and our expertise here it's called the Orady Women's Clinic, Advanced Gynecology and Minimally Invasive Surgery, hoping to bring a complete change in gynecology, not just in San Francisco, but across California, the country, and hopefully the world. I really want to change the face of gynecology in the world. And that's what I've been on a mission to do for the last 20 years since I graduated from my residency.
And you're amazing when you think of that mission, Dr. Orady. I was studying you to some degree just to prepare for our interview here. And when I was so impressed by is not only this extensive resume where you're building your skill sets and always trying to get innovative and better at what you do, but you're also a teacher. You're inherently a teacher, and you've been taking your your message and your processes worldwide and really influencing physicians across the globe. And so that's just incredible what you're bringing. And we're so lucky to have you geographically located in the Bay Area. So we're so glad you're here and joining us on the show. Speaking of which, where is your new office located?
So my new office is located at 1199 Bush Street, which is right in Nob Hill, across the street from St. Francis Memorial Hospital on the 5th floor. Very accessible to public transportation, very close to the hospital, close to LabCorp Quest, and many, Brown and Toland providers and many primary care providers. I see a lot of patients from all over the Bay Area, California. As I said, I really see patients from pretty much all over the world because of that, reputation of being kind of the problem solver or the Sherlock Holmes of gynecology, which is a nickname that I got really early on in my career when I was at the Cleveland Clinic as their director of robotic surgery at their Center for Fibroids and Endometriosis. It seemed like there was 110 gynecologists in my department there, and I was sent the ones where no one else could figure out what was going on with them in terms of their pain or infertility or abnormal bleeding, or
That's amazing.
younger patients. So teenagers with pain or bleeding, or like older women with again pain or bleeding, or patients with unexplained infertility. So I kind of got all the patients that were, we don't really know what to do with them. They're unexplained. And as you said, I have traveled to more than 45 countries, sharing my expertise, teaching and learning. Don't forget, when you're traveling and meeting experts from all over the world, I've really learned about the intricacies of gynecology and the different fields in terms of being able to diagnose things like abnormal bleeding, adenomyosis, endometriosis, polyps, abnormal hormones, and all sorts of ailments that affect women across their lifespan. And because of that, I actually stopped doing obstetrics in 2011 because I just felt that gynecology, I always called the problem child. You know, it's always obstetrics and gynecology. It's kind of like the forgotten second twin of obstetrics. And I felt like we really needed to focus on advancing gynecology, advancing diagnosis and treatment. If you realize, when I first graduated medical school, like 25 years ago now, most patients who had abnormal bleeding or pain were only offered one of two options: a birth control pill or hysterectomy. And
Wow.
I was actually one of those patients, and I couldn't accept that. I was like, no, but we're just band-aiding. A hysterectomy is just a band-aid, and a birth control pill is a band-aid. I want to actually know what is the root cause of the bleeding or the problem, and to be able to treat the root cause. And that's actually what led me into really figuring out, how do I diagnose patients accurately? Abnormal bleeding isn't a diagnosis, that's a symptom. What's the actual cause? And then how can I treat that surgically in a minimally invasive fashion to actually treat the underlying problem, not just a symptom? Like we want to treat the cause rather than the effect. And that's kind of what led me to traveling the world and meeting world-renowned gynecologists, learning new skills. And, you know, I wrote many, many book chapters, and I taught many, many residents, fellows. I actually developed the entire curriculum for gynecology at the Cleveland Clinic. I had like a series called Gynecology 101 and Surgery 101, and really would take things down to the root, because I think, especially in the US, I find that it's very much focused on just treatment. You know, oh, you have abnormal bleeding here, here's your fix. But there's not as much emphasis as in a lot of other countries that I've traveled to on actual diagnosis, because a lot of the treatments aren't available in the other countries. And so there's a lot more focus on differential diagnosis, on figuring out what the actual root cause is, and trying to treat that holistically, whether that's with diet, exercise, medication, surgery, you know, to fix the underlying problem, rather than saying, oh, every patient with infertility needs IVF. Well, most people in other countries, most people actually can't afford IVF. So why don't we actually fix the problem surgically and get them pregnant naturally, rather than having to do IVF, for example? Or if someone is failing IVF, then where do we go from there? Why can't we solve the problem, which often is a very, you know, it's something like endometriosis, polyps, septums, Müllerian anomalies, polyps, fibroids, things that we can fix surgically if we really focus on the underlying problem. And then that really helps us treat the problem, and then patients can get pregnant naturally, or we can resolve their pain issues naturally. The other thing is that there's a lot of other symptoms that I found that would get ignored, like pain with sex was a big one. I saw a lot of patients with painful intercourse, and a lot of them unfortunately thought, oh, that's normal. You mean it's not supposed to hurt? Oh, no, it's not supposed to hurt. It's supposed to actually be pleasurable. And if it hurts, we need to actually fix it, you know? And it was really sad to me that I saw patients with things like painful intercourse or painful bladder syndrome, or people had to wake up to pee 3 times a night or 10 times a night, or, you know, where they weren't sleeping because of uncomfortable bladder symptoms. And it was like, well, we can do this treatment and that'll help you with that. And it's like amazing to me how a lot of women were living so many years with really horrific symptoms, painful periods, painful bleeding, painful sex, urinary symptoms, bowel symptoms, and all of them thinking, oh, this is just how it is. It's because I'm a woman and this is how I'm supposed to be. And I want to change that, you know, and I want to change it from when the patients are young too, which is why I actually studied pediatric and adolescent gynecology as a part of my training, because I thought, why are we not diagnosing these diseases early so we can prevent it before it becomes a chronic problem that they've lived with for years, that some people actually change their entire course of their life just because nobody ever addressed their symptoms, or it was blown off, or here, take the pill, and then a year or 2 or 3 later the pill doesn't work anymore, and then what? Then they think, oh, there's no solution for me.
Well,
so
I have to say, your passion is overwhelming. I'm like, wow, yes.
I'm sorry, I could talk for hours.
Oh my
You're gonna have to interrupt me and tell me to stop. But
I 100% love it, you know. So, and I just wanted to take a step back because your passion is palpable. Like, it's amazing, and that's why you're doing such amazing work out there. And you know, when I hear you talk, it's even more dynamic than when I read it on paper, right? So it's just incredible to get to know you and just see all the good that you're doing. And when I think about how women just in general for their conditions have been underserved or minimized, and you're just bringing it all to the forefront and making it not okay, that really is a connection point for me. And I think that's amazing for my audience, because I feel like you're talking to a lot of people in that situation that are feeling that way. So I thought we would just take a step back for a second, because how did this all begin, right? You know, because obviously now I heard you sharing that you had an experience and you were one of those patients, and that really sparked your passion. But was that when it started that you wanted to become a gynecologist, or how did that all start? And what's actually, the backstory?
Much before that. So I actually, ever since I was a little kid, I like loved the thought of healing people and taking care of people. I was the 4-year-old with the little doctor kit and the stethoscope, and my poor twin brother, he was either a sick dog and I was a vet, or he was a sick patient and I was doing surgery on him, or he was, you know, an accident victim and I was the ER doctor. Like that was all my play as a child. So I don't know, I felt like I was born to be a doctor. And then when I was 9 years old, I was in my mom was a professional woman, and she had a professional women's group. And every time she would take me with her, and every time we would go, all of the lunchtime, the women were complaining, I have this problem, I have that problem, I have this problem, nobody's listening to me. Like, and I was just like, I have to help these women. And I decided when I was 9 that I was going to be a gynecologist at 9 years old.
Unbelievable.
and then I was like, well, what am I wasting my time for? And I actually accelerated my studies. I went to college when I was 12. That's a little known fact about me.
Oh my goodness, that's incredible.
I started medical school when I was 17. I started residency at 21. At 25, 26 is when I started doing robotic surgery and minimally invasive surgery and advanced gynecology. By the time I was 30, I'd already been to 40 countries, speaking and explaining and publishing my new techniques, and, you know, how to manage menstrual disorders. And, you know, when I was 40 was when I came here to San Francisco after my stint at Cleveland Clinic, where I became a real expert at menstrual disorders and fibroids, endometriosis, pediatric gynecology, like, as I said, all sexual dysfunction, sort of all the things that were like the, you know, the problem children of gynecology that most gynecologists would rather someone else figure out and deal with.
And I'm here to tell you about a health plan called Aetna. Aetna is a health plan built on solid ground with over 170 years of experience helping people with their healthcare choices. Aetna offers Medicare Advantage, Medicare Supplement, and Part D prescription drug plans across multiple counties across the country. Aetna is known for their innovative product designs, especially on their medical plans, including things like vision, dental, hearing, and more. It might be time to consider Aetna for your healthcare coverage. For more information on Aetna Medicare plans, please visit their website at aetnamedicare.com or contact your local agent. Thank you.
And when I came here, I really wanted to create a center where women could come from all over the world and get exceptional gynecologic care. That's why I call it advanced gynecology. It's not just regular gynecology, although we do provide normal gynecology. I have a wonderful physician assistant who's amazing. She does all the primary care, annual exams. You could get an annual exam with her tomorrow. She has lots of openings, and she has so much knowledge from working with me so closely that she's very good at like picking up on these symptoms and then sending them to me and saying, hey, I think she may have this or that or the other thing. But we do all the full scope of gynecology. We don't do obstetrics, but we do the full scope of gynecology at this at the Orady Women's Clinic. And it was my goal to do that here in San Francisco. And I partnered with Dignity Health initially, and I partnered with More Care after that. But then I figured out that if I really want to do it my way, you know, with this focus on not just taking care of women medically, but their whole needs, their psychology, their emotions, their dreams, their hopes. Like, I don't want to just treat the disease. I want to treat the entire patient. That's when I decided I really need to open my own clinic, and I kind of took the leap. 2 months ago, we just opened, actually August 11th, we started the Orady Women's Clinic.
That's really exciting.
And it's been a whirlwind. There's been so much, but I really, you know, want to create an environment of caring and relaxation. You know, my patients are laughing. I have like aromatherapy and waterfalls and soft music and eye masks if you want to go into our like meditation room after
little zen while you're having your exam. Perfect.
Exactly. Like, and I have educational videos running, you know, and I've actually put out there that anybody who wants to give a suggestion of what they want to see in a state-of-the-art advanced women's clinic to let me know. And with that, along with what we do in clinic, I bring the most state-of-the-art surgery. So I do office hysteroscopy. I just 5 minutes ago, I was seeing a patient who was told she has to go to the operating room to have her polyp removed and go under anesthesia. I did it in the office under local in 3 minutes. And she's like, why would I ever go into surgery to have something so simple treated, you know, immediately? And I was sharing with her that I had the same problem. I had a polyp, and I couldn't find anyone in San Francisco to remove my polyp without putting me under anesthesia, which I don't like. I don't like the effects of anesthesia.
Why would anybody want that?
I flew to Boston. I flew to Boston to have one of my friends take my polyp out. And I was like, well, we need to do that here. And so I brought that to my office with state-of-the-art equipment, microlaparoscopy for teenagers. Like, why do we have to have huge incisions? Or for young women who are doing mild endometriosis? And I have a whole article on that. And I teach courses on microlaparoscopy every year. This year we're teaching it in Florida. Actually, next week I'm going to teach that course. CO2 laser surgery, of course, advanced robotic surgery, which is why I'm the director of robotic surgery at Dignity. I brought the robotic program here. I've built it from the ground up. We have the most state-of-the-art robots. I actually work with robot companies to develop even better robots. So robotic surgery has been a passion of mine.
So Dr. Orady, I know you're the director of robotic surgery at St. Francis, and I know it's a huge passion of yours. Just for our viewers, would you mind sharing a little bit more about what robotic surgery is and how it, by using that as a tool, actually helps with better outcomes?
Well, so robotic surgery is laparoscopy. So a lot of people are confused about that, you know, is it a laparoscopy? Is it an open surgery? I call it the bridge between laparoscopy and open surgery. So laparoscopy is where you have small incision, small camera, you look inside, you treat the disease, or you remove whatever you need to remove with small instruments. With microlaparoscopy, the instruments are so tiny, they're like 2 millimeters. So there's literally no incision. We call it needleoscopy. There are needles that go through the abdomen. We do whatever we need to do with these little needles. Very delicate and intricate, which is why, again, there's not very many gynecologists in the country that do it, but I still continue to teach the courses because I want more people to do it. With robotics, you have the ability to magnify everything inside 10D, 10X, HD, and you have instruments that you can move literally as your hand. I call it like the Wii, or, you know, not a PlayStation, but you know, the Wii where you can play tennis.
Exactly.
It's like that. I can literally move the robotic instruments and it mimics exactly what my hand is doing. And what that allows me to do is do even the most delicate, intricate dissection, most intricate surgery with the same precision of my own hands, and actually more precision than my own hands, because the tremor is removed, the movements are scaled up. So you can literally do very fine, very delicate surgery very precisely with the robot. And it allows us to do surgeries that would be almost impossible laparoscopically, that the patient would need to be completely open to do, whether that's a hysterectomy, whether it's endometriosis excision from the deep spaces, whether it's, you know, peeling a cyst off of an ovary while trying to preserve as much of that ovary as possible. The level of intricacy and delicacy of the robot is unsurpassed. It's quite amazing. And what it does for my patients, the most accurate, most precise surgery that can be done, which is why we can preserve fertility. And actually I've helped so many women get pregnant just by doing these type of surgeries on them, or help them resolve their pain by peeling endometriosis off their nerves, off their blood vessels, off their rectum, off of deep spaces, and completely resolve that pain in patients where they were told their surgery is not even possible. That surgery, it's too different. It's not possible. You have to have everything removed. We can't save your uterus. I've been able to save patients' fertility and do surgeries that were literally touted impossible by using robotic surgery, with the same recovery that laparoscopy allows, of 1 to 2 weeks recovery, back to work, tiny incisions. You would never even know they had surgery. A lot of my patients, my patient today, she came to me from San Diego, had a very complicated robotic surgery. And she said, I feel like a completely new woman. I can't believe how fast I've healed. And she's just ecstatic with the results.
It must be the best in terms of hearing those outcomes. So I had a question for you just in terms of robotic surgery, because it sounds incredible, non-invasive, great outcomes. I mean, you're so passionate about that along with so many things. But I guess what I was curious about is, you kind of mentioned that you're still teaching it, but not everybody's adopting it. I mean, what is holding people back from adopting this? Because this sounds to me like,
I know, right?
A million times better than anything else. I mean, I'm just blown away by the results and how non-invasive these things are, and the outcomes. It's just incredible. So what's
and to me, I feel the same way. Like every time I teach the courses, they're like, oh wow, this is amazing, this is great. And then I'm like, then I come back next year, I'm like, did you do it? Did you do it? And they're like, no, didn't do it. I think honestly, it's lack of enough training, right? Like it's a lack of the confidence to be able to adopt something new. And that's why I've actually started my fellowship here at the Orady Women's Clinic. I'm looking currently for a fellow to start in July. So if you know someone, please let me know. But I think they just need a 1 year hands-on kind of seeing what I do, because it is so different than what is done traditionally in OB/GYN residencies and such, that I think you just need a mentor that's going to help kind of handhold you through it, not just a course or something like that.
I love how you're just so passionate about paying it forward, and just as busy as you are, you make time to do a fellowship and to bring people along, and just that's the passion you have for what you're doing.
I mean, I just want women to have the best care possible. I mean, it just breaks my heart when I see patient after patient, day after day, how many years of suffering it took them to get to see me. And it's just like, it shouldn't be that long. It shouldn't take this long, you know,
it definitely shouldn't. And I'm so happy that we have you. I want to multiply you a little bit, so I have to figure out how to do that, right? But
my PA is one, Grace Banks. She's wonderful.
Exactly.
She's an extension of me.
Another, right? So
and once I have a fellow, I mean, I'm hoping they'll, you know, I'm already mentoring medical students and residents and all when I go to these conferences and teach courses, and I'm like, someday you're going to be my fellow, and we're going to, you know, I want to expand. I want to have more of me all over. Yeah.
I love it. One question I was going to ask you is, in medical schools, like, you know, at the core, not necessarily just the conferences and this type of thing, are they teaching robotics as part of the curriculum now? And
they are, yeah, not somewhat in medical school, but in residency, robotics is starting to be taught. The problem is it's not just robotics, right? The diagnosis is super important, which is diagnostics. And then the difficult, complex robotics like endometriosis honestly needs its own fellowship. Because it's such a difficult disease, and first of all to diagnose, and second of all to treat properly while preserving fertility. Like again, if you go back 10 to 15 years ago, when endometriosis was treated, it was again hysterectomy, birth control pill. There was no like fertility or IVF. There was no like fertility preserving process of removing endometriosis while preserving someone's ability to have a baby, or actually improving their ability to have a baby, and at the same time relieving their pain and suffering. So there are a lot more. There's a couple of fellowship programs. I am the president of the Society of Laparoscopic and Robotic Surgeons, and we have multiple fellowship programs that are starting to develop in endometriosis. But again, early field, there's not that many, maybe 10 across the country. So
Right.
it's
really at the forefront of everything that you're doing. So
yeah.
now, Dr. Orady, we work mostly in our business, we work mostly with Medicare patients. One of the reasons that you and I got introduced is that we work with so many of the Medicare health plans. And in California, the Medicare health plans work with medical groups. In this instance, Brown and Toland Medical Group, which you're a part of. And so we're really focused on the agents and brokers out there making recommendations for patients to be able to come and see you, being able to purchase plans where they can have access to you through this Medicare Advantage umbrella or straight Medicare. And so just with that in mind, that these are the patients that are listening today, and these are the agents and brokers that are making those recommendations. Are there any conditions that you find at the forefront for an aging population? And, what are, senior women facing that are different than some of the younger women, and how are you handling those situations?
Yeah, I mean, as you go through life, everything changes. And I think by the time you get into perimenopause, menopause, a lot of times women have had problems that have not been addressed. As I said, things like urinary problems, pelvic pain, pain with sex, hormonal fluctuations, abnormal bleeding, heavy bleeding. A lot of them, I hear this a lot. A woman comes in, oh, I have these horribly heavy periods, but I thought that was just a part of getting older. No, there's nothing that says that as you get older, you're supposed to bleed more. That's absolutely not correct. There's something wrong that we need to fix. And then post-menopause, little bit of spotting, a little bit of bleeding can be a sign of things that are precancerous, polyps, hyperplasia, that we can actually prevent uterine cancer or cervical cancer if we diagnose and treat it early. So a lot of patients, again, in their late, oh, I'm spotting after sex. Oh, I thought that was normal when you're older. I'm having, really bad dryness, or I'm having pink discharge. That's not normal when you're older. It's not.
Right.
A lot of people, so there's a lot of ignorance of what is normal and what's not. As we
questions that people aren't always comfortable asking.
Yes, and they're not, and women don't talk about it, and it's really wrong, because I think we're all embarrassed, and it shouldn't be embarrassing. We should know that after menopause, there should be no bleeding, not one spot drop of blood.
I think for a person who declares they're going to be a gynecologist at 9 years old, you've never known any embarrassment on the topic whatsoever.
No, not at all. No. I've always been talking about menstrual periods.
Exactly. This has been your lifelong passion. Yes. That's unbelievable.
Yeah. So those are the things. I mean, women who are older, they need to manage their hormones. We need to make sure they aren't developing anything that might affect their health, like cancer or polyps, precancer. And then we need to treat them so that they have a healthy sexual life, that they have a healthy, vaginal flora and texture, and that we treat things like abnormal bleeding, infections, pain, prolapse, like all these things need to be treated. And I think a lot of women just take it as, oh, I'm just getting older, I just have to live with it. Why do we have to live with it? Who said that? Probably a man, honestly. So, I
almost guarantee it was some man that said that. Yes, right. And I just I think you're so right. When I think of even, my friends, and people my age, in their 50s, or, people who are over 65 who I work with a lot, I feel like there's a lot of that. Like, there's just a trend, like, oh, I just live with this. This is just a thing. And, that's just how life is, kind of thing. Or things get broken as you get older, or whatever. And, oh, welcome to older age. And it's like, when I listen to you talk, it just makes me feel so hopeful and optimistic, across so many avenues, right? But particularly with gynecological health, it just seems like we don't have to be restricted, right? We should be investigating and getting under the hood, so to speak.
Yeah. And even if the answer is yes, you're getting a little older, you're going to have some of this, but at least check it out. Like, I think for me as a woman, even when I first became a mother, there were problems with my child, and I was blown off a lot. Like, oh, you're just anxious. Oh, it's not. And then it turned out that I was actually right, that these things weren't normal, and that there were problems that we had to treat. And I was kicking myself for it. Why do we as women accept someone to say that your concern is not important, or that it's nothing, or that you're anxious? Absolutely not. we should say, oh no, it's bothering me, it's my concern. And if someone's not listening to you and is just blowing it off, go to find someone else that will listen to you. That's,
Right.
I mean, we should continue looking for another doctor that will actually listen to us. And that's what I encourage women to do. And that's why, you know, it is
100%.
important that we have all these health plans for our Brown and Toland patients and Medicare patients, because they need healthcare too. And
Right.
they need
100%.
to advocate for themselves.
100%. Well, I feel like any patient would be lucky to see you and be part of your practice. It's incredible. Your passion, your care and concern, your just genuine passion just makes a huge difference, but it's like matched with skill, right? So you've got all the love and the skill like combining, and then we have you, Dr. Orady. So I just feel like anybody would be blown away. I live in Nevada. I want to cruise over and see you right now. Check everything out. Make sure I'm good. I love it. So,
Yeah.
so speaking of which, I know you have some bandwidth in your practice to be able to take on new patients.
Yeah.
How would you suggest people get in touch with your office if they're interested in making an appointment or seeing you as their gynecologist?
Well, honestly, we just launched our website, drmonaorady.care, and we just launched online scheduling. You can go on the website, book an appointment right then and there. You don't have to be a part of the portal or anything. You can book online. You can send us a message. You can call our office, but I think the easiest thing is just to book online, see what appointments are available, and grab one.
Sounds amazing. Can you please repeat that address one more time?
www.drmonaorady, DRMONA Orady, ORADY, all one word, .care.
.care. Okay, perfect.
Care,
You got
because
it.
we care
Perfect.
about our patients.
100%. Well, that shows shining through, Dr. Orady. I know you've got a very busy schedule, so thank you for taking the time to meet with us today. Can't wait to see what you and your team do in the future and how you expand your services worldwide. I have no doubt with your passion, there's no limits in mind. You're going to do amazing things, and I'm so glad I had the opportunity to connect with you and get to know you a little bit better. Thank you so much,
Erin.
Dr. Orady. Have a wonderful day.